Dr. Liu, can you describe what the last 3.5 weeks have been like for you?
Well, obviously, we've had a catastrophic event with our long-term embryo and egg liquid nitrogen freezer, and there are a large number of families have been affected by this. We have conducted an ongoing investigation and have notified the affected families about the incident, as well as what we know up to date regarding the freezer incident.
But for you, what has this all been like?
Well, it's been a very difficult time for myself and the staff as we try and take care of our patients, contacting the patients, understanding their particular clinical situation, and then trying to help them through this very difficult moment, especially if they have the opportunity to generate extra embryos and eggs. We are offering that to the patients.
When did you first know the storage tank malfunctioned?
We knew over the morning that it actually happened, and we notified the patients pretty much within a 48-hour span when we recognized that this was indeed a very, very catastrophic event.
When did you discover the alarm was turned off?
Well, that was much later because we were unaware that the alarm was actually not activated. We assumed that the alarm was activated at the time because it is a remote alarm that is computer controlled. And so we had to do some investigation to determine the exact reason why the alarm had not activated, and we are still having an investigation as to why it was deactivated, who ordered it deactivated.
So a single person may have ordered the deactivation of this alarm?
That is ongoing as an investigation, so we're not completely sure the events that occurred that led to the deactivation.
Whose job was it to monitor the storage tanks?
Storage tanks are monitored locally by the liquid nitrogen indicator on the computerized tank itself, and as well as there's a local temperature monitor. So both those alarms were activated at the time that this event occurred when we discovered it. There is also a separate remote alarm that we have that is not by the manufacturer, that is independent, that activates a computer that is supposed to call the embryology person to notify that the temperature had increased in the tank.
But whose job is it to make sure those alarms work?
The alarms are unfortunately not checked in this case prior to this event happening over the weekend. So I am not certain when this alarm system was tested last.
What about checking the units? How often do you check the units?
The unit is a long-term storage unit, and so it's designed to have essentially a very low maintenance requirement. The unit is quite large. It's a liquid nitrogen freezer that does not immerse the human specimens in the liquid nitrogen itself. So unlike the little units that you might see in a typical IVF laboratory, this is a very large storage unit designed for long-term storage. The liquid nitrogen is in a jacket, so you can't see the liquid nitrogen. And the liquid nitrogen then evaporates into like a vapor steam. And it's the vapor that is keeping the eggs and embryos frozen. So there's a separate monitor for the liquid nitrogen level because we can't see it. And then there's a separate temperature probes that are within the unit itself.
So did someone check on the units every day?
There is a log for the liquid nitrogen level and the temperature, but the unit usually automatically fills. In this situation, we had an issue with the autofill feature, and so we were manually filling the unit with liquid nitrogen from the storage tank manually by just pushing a button on the unit. and it tells us what level the liquid nitrogen is at.
So how often was that being done?
Usually the liquid nitrogen would, on a manual fill, would last at least 3 to 4 days. So we could watch the liquid nitrogen levels visually on the indicator, the computerized indicator.
So did anyone check on the storage tank in between when it needed to be filled?
The indicator would suggest that there was an adequate amount of liquid nitrogen in the tank to last through the weekend when it was last checked, and then so it was on the afternoon on the weekend that the technician left, because we obviously work 7 days a week, and we rely on a remote alarm as well as the local alarms on the tank. And when it came back in the morning for another procedure, the local alarms were on.
You allowed a storage tank containing people's most precious possessions to go unchecked for days at a time?
No. The technician is in the laboratory every single day, and they do check the level of the liquid nitrogen and the temperature. So the liquid nitrogen does not exhaust over a day's period of time. So there's sufficient reserve in the jacket based on the number of inches of liquid nitrogen there that is indicated on the panel to allow the liquid nitrogen to last for several days.
So someone does check on it every day?
Yes.
Once a day?
Generally, before they leave, they check the level of the liquid nitrogen and the temperature.
Did that happen Saturday, March 3rd?
Yes, it did.
Why didn't you staff this facility 24/7?
It's extremely difficult to staff a facility such as this 24/7, and certainly no IVF program that I am aware of staffs 24/7. They all rely on remote alarms for the duration when the lab staff is not conducting procedures.
But you knew these storage tanks had problems.
These storage tanks are really fairly maintenance-free. So the manufacturer actually has specific procedures for doing preventive maintenance, and we were in the midst of doing a preventive maintenance when this event actually occurred.
Given that there were problems, why didn't you put extra staff on to monitor the tanks?
The indicator on the tank, as far as we could tell, was functioning normally, so there was plenty of liquid nitrogen in the jacket to allow the liquid nitrogen sufficient reserve to go well beyond the weekend.
So when a patient has eggs harvested or embryos frozen, you always put everything in one tank?
In this situation, the tank is designed for long-term storage. So this is different than perhaps the little tanks that you see in the smaller programs.
Yeah, but you put everything in one tank here at UH.
That was the design of the tank, and that was the design when the laboratory was constructed.
Given the impact of this malfunction, do you regret that?
Obviously, in hindsight, we do, and we feel that in the future we've gone back to the lower technology tanks where we would split essentially specimens between tanks for a given individual, if that is possible, obviously.
Why weren't you already doing that?
This is an event that we did not anticipate, and so this is not necessarily the standard operating procedure for tanks of this size.
Who made the decision to just have one large tank for everything?
This laboratory was set up with expert consultants in terms of the equipment that was purchased for this and how the storage as well as the day-to-day equipment that is required to conduct IVF procedures. So this is a pretty sophisticated, state-of-the-art laboratory.
To your knowledge, what caused the temperature to rise in the tank?
Obviously, the liquid nitrogen level was much lower than what we had surmised in terms of the readout, but we do not know the reason why the tank reserve of liquid nitrogen was insufficient to maintain the temperature, because based on the readout on the computer console, there should have been sufficient reserve liquid nitrogen in the tank.
At what point should the alarm have gone off?
The alarm goes off for low liquid nitrogen levels and for temperature. So there's two separate alarms for that on the tank itself. The remote monitor monitors temperature only, and that should have also been set off.
So there were two alarms that should have gone off and neither did?
They both went off. The local alarms did go off when the technician came in the next day. Unbeknownst to us, the remote alarm was deactivated, and we were not aware that the remote alarm was deactivated.
What should have happened? The remote alarm would have been deactivated, and then what would have happened from there? What should have
The remote alarm should have been activated. The embryologist would have gotten a call and would have come in to at least identify the issue. Probably at that point in time would have heard the local alarm as well, and at that point did a manual fill on the tank.
Would that have saved the eggs and embryos?
Most likely, if that alarm was present, yes. Because again, the temperature setting on the remote alarms as well as the local alarms is well within the tolerance of embryos in terms of temperature.
How many hours did you have?
We do not know when the temperature rise had occurred, so we don't have that information at this time.
If the temperature gets too high, how long do you have to get to them?
So the temperature readout is obviously on the unit, but we don't have the hour-by-hour changes that you're asking.
How often has the alarm gone off?
I do not know the frequency in which these alarms are triggered at this point in time. We don't hear the local alarms very often. The units are automated, so there shouldn't be much in the way of alarms at all from both our units, because they have autofill features, and so they're really relatively maintenance-free and designed to be that way.
How many times has the alarm gone off over the past few years? Or what I should say is, how many times have those alarms gone off?
Don't know the answer to your question precisely, so I can't...
You don't track when there are mistakes?
We don't track every alarm in terms of when it goes off. We only track the temperature and things. So I'm not sure that the alarms go off at any great frequency at all.
But they have gone off in the past.
I'm not aware that they have gone off in the past.
You don't know?
I'm not aware that they have gone off. It's an automated feature. So it's kind of like your car. When does your car computer say, check engine? How often does it do that? Because it's all automated. You have a computer. It's a similar sophisticated system.
You're not keeping track of how many times there's a problem?
We're keeping track of the temperature and the liquid nitrogen level. Those are the two critical indications that the embryos are protected.
How many times has there been a problem with the temperature then?
As far as we're concerned, this is the first incidence that we are aware of that the temperature went above the accepted limits.
You know of no other incidents?
Not that I'm aware of.
Are you looking into all possible explanations for this failure?
We're looking at how the tank performs, whether the issue with we're investigating the issue with the remote alarm. So these are things that are still in process.
What about sabotage?
We're looking at that at this point in time, and we do not feel that that's likely, but that is certainly not dismissed.
Is an embryo life or property?
That's a question that is an ethical question, and it's an individual religious ethical question.
What price would you put on an embryo?
I think that's a question that isn't, that is individual. And obviously, for a given family, that's really very, very precious to them, and we understand that. And it's a difficult time for the families. And we very much want to help all the families in this kind of situation.
Some people have lost their last chance at having their own child because of your facility's failure. Can this fertility center recover?
I think our focus really is on the patient and trying to help the patient on a one-by-one individual basis, given the circumstances. So we'll do our very best to address the issues and the clinical circumstances for the patients, and that's what we're trying to do. And it takes time to contact each patient, identify their needs, identify their decision-making, and what their best wishes they want to do in the future.
But what's the impact here?
Well, the impact is that we do have to have considerable efforts to be able to take care of each individual patient and their needs. If they need counseling, we provide the counseling. If they want to generate additional embryos and they have the ability to do so, we will do so. If they have the ability to generate additional eggs, we will do so.
Why would any fertility patient want to come here?
Because we take good care of our patients as best we can on a case-by-case basis.
How can you say that?
We individualize it.
Essence of time here.
I understand. I want to ask one final question. Who will be held accountable?
I think UH is responsible for this, and we are upfront with our patients. We really want to tell our patients exactly what we know, and this investigation is ongoing, and we will tell them when we are completing our investigation what the findings are.
Who do you blame?
I don't think we can blame anyone at this point in time until the investigation is conducted
Are you
and
to
completed.
Doc, we're done. It's 3:40.
Got it. Thanks for your time.